first of all po, ano po ba ang maaari po nating magawa to reset our health na medyo na-disrupt last holiday season? As I was saying to Miss Annie earlier, I really ate a lot of unhealthy food during the holidays because yan po ang pre-present sa atin ng mga nag-organize ng mga parties. Go ahead po, Dr. Michelle.
Before we go ahead and discuss kung anong gagawin to reset, I'd like to emphasize na let's not be so hard on ourselves, no? Isa sa portion and part of lifestyle medicine intervention is you have to be the most friendly person to yourself. So if you think holiday is one way for you to reconnect, bond with your loved ones, and of course food is there, let it be, no? Kaya lang meron nga tayong tinatawag din na awareness, and somehow, no, iniisip natin how can we still take care of our health even during the holiday season and in front of you lahat holiday treats, no? So yung question mo is how do you reset? I would think and I would say na it wouldn't be hard if somehow may naumpisahan ka ng healthier lifestyle throughout the year. Siguro mas magkakaproblema tayo dun sa mga patients or tao na talagang wala naman silang routine or healthy routine na ino-observe. No? So, during the holiday season, it's not only diet kasi ang kailangang i-reset. In fact, marami. So, we're also thinking na hindi rin kasama dun yung stress level, kasama dun yung sleep disruption. I'm sure you would agree with me that hindi maayos din ang tulog. Somehow, yung iba sobrang tulog or yung iba talagang hindi rin nakakatulog because of the events here and there. So, to reset in terms of the food, maraming pwedeng pag-usapan, but I want to mention first, no, yung mga general. First is actually sleep. So, go back to having enough sleep. Balikan mo yung circadian rhythm mo. Balikan mo yung routine. Why am I saying this? Because this will actually determine hormonal balance sa katawan natin, especially when eating. So, dito papasok yung ghrelin hormone, yung cortisol hormone, yung melatonin, and then yung leptin. Si ghrelin and si leptin are the eating hormones. So, mas prominent itong, mas mababa yung leptin natin actually pag hindi maganda yung ating tulog or nadi-disrupt itong dalawang ito. So, that's why pwedeng nag-overeat tayo kapag kulang sa tulog. So, first thing to do to reset, and I think this is the most important factor, having restorative sleep. And then, of course, we wanted to integrate not having too much light at night. So, that means exposure ng mata natin to screens, for example, para ma-enhance yung restorative sleep. Remember, yung kasing ating blue light coming from our phones, coming from our laptops or television, they are interpreted by your retina ng ating mata as sunlight or daylight. So kaya yung melatonin hormone mo bumababa. So hindi na-trigger, no, or hindi na i-enhance yung sleep hormone para makatulog ka. So of course, we wanted to manage stress, increase your physical activity so that you can somehow burn some of the excess calories we took from the past holidays. And then we also wanted to reduce your sugar intake and of course, eat healthy fats, no? And then ini-emphasize din natin, Ms. D and attorney, is the increase of intake ng fiber this time. So for us to reset, maraming pwedeng pag-usapan. It's the gut microbiome. Baka mas maraming meat-centric plate ang nakonsume natin the past holidays. I think this is the right time to help your gut to reset. So ang paboritong pagkain ng good bacteria is fiber. So anything that's fibrous, you can find that from vegetables and then fruits, whole, no? Or whole grains, no? If there are persons who cannot really take enough amount of fibers, pwede silang kumuha ng mga fiber supplementation. Merong mga fiber drink na pwede nilang i-fortify doon sa kanilang mga drinks just to enhance the intake of fiber. Remember, fiber is a good food for your good bacteria so that when they increase, no, bumababa yung inflammation sa gut. So that's how we reset the gut. And of course, yung sinabi ko kanina, to avoid overeating, we have to manage sleep. So I think we gave ourselves the indulgence for the past holiday. So why not think about restricting calories? Why not think about intermittent fasting if it is possible, and then increase your physical activity para mabalanse mo ulit yung mga calories na na-take natin. And then maybe re-educate yourself. Tignan muna natin. Practice the 24-hour recall again. What we mean by 24-hour recall is thinking what I ate yesterday. Ano ba yung nakain ko kahapon? So kahapon, siguro mas maraming fat yung nakain ko kahapon. Siguro mas babawasan ko ngayon. Or yesterday, halos wala akong nakain prutas o gulay. Kailangan magdagdag ako ngayon. So practice the 24-hour recall again because that will enhance your awareness. Kasi pag aware ka na yesterday kulang or yesterday was sobra, ngayon, mamomodify mo yung intake mo. Pag hindi kasi ginawa ito at the end of the week, no, you wouldn't realize baka sobra ulit yung nakain mo on the unwanted or sobra dun sa mga unwanted nutrients, and then kulang ka naman dun sa mga essential nutrients.
Atty.Dot, have you
very well
noticed?
said.
Yes, napakasarap
Yes.
kausap niya eh. Napakasarap ma-interview. Punong-puno. Sa unang tanong pa lang, arangkada ka agad. Punong-puno na ng mga impormasyon, Atty.Dot.
Yes, Miss Annie. Miss Annie, alam mo, meron akong isang gustong malaman, no? Speaking to an expert. Doktora, well, you talked about yung kulang ng tulog, no? And some of us, well, ako in particular,
You're
I
guilty.
don't sleep enough. Oo, I don't sleep enough. What can you say about melatonin, yung iniinom para makatulog? And what are the other supplements or vitamins that a person should take in order to become healthy? Go ahead po, Dr. Michelle.
Unfortunately, there's nothing that can replace sleep. Kaya nga tinatawag natin, kahit pa natutulog yung mga tao, they thought they slept, but it's non-restorative. So that means pwedeng natutulog ka, but somehow you're aware of the environment, no? Or disrupted yung sleep mo. That's why we always say restorative sleep and practicing sleep hygiene. Melatonin can help induce sleep, pero hindi siya sleeping pill ha. So si melatonin kasi is a normal hormone produced in the brain so that it triggers sleep. So, pinapatulog ka niya. So, melatonin can help, but then it's not a prescribed, what do you call this, supplement. Nakakatulong siya. Other supplements you're asking kung ano yung pwedeng i-take for patients to enhance or boost their
Yes.
sleep. In fact, any antioxidants, anything that's high in lycopene can be very, very good. Lycopene can be taken from anything that's colorful. Let's say yellow-colored or orange-colored, no? Matataas yung lycopene nila. Number one is tomatoes. Pero ito kasing tomatoes, mas mataas yung absorption mo ng lycopene if it's cooked or prepared, so hindi siya hilaw, no? Beta-carotene are also really, really good, no, in enhancing sleep. So this is a fat-soluble vitamin. Pero si beta-carotene is more absorbed. It will be better absorbed or mas mataas yung bioavailability niya when you take it with acid. Kaya pag nilagay mo sa salad yan, maglagay ka ng balsamic vinegar or kaya any acid, lemon ba, para yung absorption niya mas mabilis or mas marami yung ma-absorb mo na beta-carotene, no? But in terms of having food supplement to restore your sleep, wala pong makakagawa nun. They said massage can restore sleep. That's not also true. That can enhance, better sleep. But then, yung utang mo na tulog yesterday, hindi mo na kasi siya maibabalik today. So remember, our immune system is really dependent, on how we sleep, because that's how your body restores, that's how your body resets, and that's how your body heal itself, no? Nandun during
Okay.
the time that you're resting, your body is actually healing itself. Yeah.
Sarap
Yes.
pakinggan,
Doktora,
Atty.Dot.
okay. Oo. Before I give you, Miss Annie, what about for your general health? No, let's not talk about sleep anymore. Okay, you have discussed that already. What about yung general health? What should an ordinary individual take as supplements po? Or do you really prescribe taking vitamins and supplements? Or para po sa inyo talagang fruits and vegetables? Go ahead po, Doktora.
In the real world scenario, depende kung saan nakatira yung tao. So if they live in the countryside, if available naman yung pagkain, and if the food doesn't need to be fortified, meaning kompleto yung nutrients nung kinakain nila, they don't need supplements. So we apply the food first perspective. However, there are a lot of instances where people are living in a busy world. Nasa metro ka nakatira, no? Yung nakakain mo, yung available lang in the morning, kung ano na prepare mo na kaya mo, minsan wala nang ang breakfast, and then kung ano yung available at lunch, yung binibentang malapit, yun ang kakainin, and then at night, no? Kung ano yung makukuha mo, dadaan ka, madadaanan mo, mabibili mo, or you have time to prepare, so that's the only time you prepare. So that's why kahit kami sa aming practice, no, we do require 24-hour food recall, pero we always ask for at least 3-day food diary. Yung 3-day food diary na yun, gusto namin ng isang araw na weekend and then 2 days na weekdays. Kasi iba yung food intake during weekdays, iba yung food intake during weekend. Now, as always, when we look at patients and when we evaluate, maraming nutrients na hindi kumpleto doon sa kinakain. There's what we call monotonous diet among Filipinos. Very common yan. Kung nakasanayan na isda sa umaga, isda sa tao, or isda sa tanghali, isda rin sa gabi. Minsan yung tira sa tanghali, yun din ang kinakain sa gabi. So if you look at the nutrient profile, makikita mo na talagang medyo deficient. So if we think that there's deficiency in the micronutrients that we are eating, then there's room for food supplementation. So the multivitamins, regular multivitamins will do. But for patients na mabababa yung immune system, they would know. Kasi sa isang taon, ilang beses nagkaka-colds, mabilis magkasakit, right? So maybe they would need more antioxidants. Maraming antioxidants available in the market or in the pharmacy. Vitamin C with zinc will do. And then there are many antioxidants available then from extracts of vegetables and then fruits. So these are what we call the active substances, no? Or active constituents that they put on a pill. So it's in a pill na nandoon na isang inom mo lang, so you have load of antioxidants. But again, it cannot replace the enzymes that you're supposed to take from your meals, from your pagkain, ano? But it will help you. Kaya nga sinabi natin na supplemental to the food that you are eating, just to keep you healthy, no? And to keep you healthy and in your well-being.
Para kayo nag-lecture,
Yes.
Doktora. Nakikinig kami ng
Ang
gusto.
galing-galing,
Sarap
di ba?
pakinggan. Nilista ko ng gusto.
Alam mo, ngayon ko lang na, Miss Annie, ngayon ko lang naisip, no? Oo nga, supplement. Kaya nga sinabing supplement yan, pangdagdag mo lang yan. Hindi ibig sabihin na yan na will take the place of the food that you are supposed to be eating, which is healthy. Sige, Miss Annie, I'm sure, gigil ka na rin magtanong. Go ahead, Miss
Alam mo,
Annie.
attorney, another round, Dr. Michelle. Susunod ulit po, ha? Guest ulit namin kayo dahil alam ko maraming naging makasadlanan nitong holiday season. Ayan, sa pagkain, pati dun sa tulog. At sinabi niya kanina, yung immune system natin nagdidepende dun sa ating tulog dahil, di ba, mayroon tayong nakikita maya't maya sinisipon, napakabilis sipunin. Doktora, at this point, Doktora Michelle, muli, gusto namin marinig ang inyong panawagan, mga announcement, para at least ma-warn, ma-remind yung ating mga kababayan naging makasalanan nung nakaraang holiday season dahil sa iba't ibang mga kinain pagkatapos yun sa mga kulang sa tulog. Go ahead po, Doktora Michelle.
Like I said kanina during the opening, we need to be kind to ourselves, no? But we have to remember, iisa lang kasing buhay. So to keep ourselves healthy is the most we can do. Isa lang ang buhay, alagaan kapag tayo na-stroke na, pag tayo nagkaroon na ng heart disease, hindi mo na mababalik yon. So what we can do during these holidays, maybe we can do a reset in our practice. Meron kaming program tinatawag na lifestyle medicine redo. So that means it's somehow of redoing some of the faulty lifestyles na meron tayo. So in a real life scenario, wala pong perfect na lifestyle. No, let me remind everyone, no matter how you tried to be so healthy, wala pong perfectong lifestyle, but we can always improve, and that's good news because lifestyle can be enhanced and lifestyle can be modified, meaning we can do something about it. Pag tayo may sakit na, may babalik mo pa ba? It's good news because diabetes can be reversed. We can achieve remission, hypertension, pwede din. But when you already have block sa ating brain, nagka-stroke stroke ka na, and then pumunta pa sa heart, nagka-heart disease ka pa. So dual na yung naging problema mo, and then it will complicate throughout, it will progress, throughout your life.
Okay.
So we only have a limited lifespan in the Philippines. Miss Annie, Atty.Dot, ang Pilipino mababa po ang lifespan. Lower than 10 years than other countries. So how do we enjoy that
Grabe.
lifespan? We need ourselves healthy.
We want to
Yan.
invite you again next time, Dr. Michelle. Huwag kayong magsasawa sa amin. Alam mo, gusto namin kayong laging kasama dahil tingnan mo naman ito, Atty.Dot, nakakapukaw talaga ng ating mga natutulog na kaisipan. Ay naku, nasi-set aside yung mga mahalagang bagay. Ayan, napaka-importante nitong binabanggit ni Dr. Michelle. Atty.Dot, go ahead po. Pasalamatan na natin sa hapong ito. Si
Yes,
Dr.
Miss Annie.
Michelle.
Oo, masakit man sa aking damdamin ang pakawalan. Wala na po tayong time. So, Dr. Michelle, please come back again. Dr. Michelle Palma, of course, is the president of the Philippine College of Lifestyle Medicine, or PCLMC, and the medical director of Lifestyle Medicine Solutions. We are so honored to have you with us, and we learned a lot from you. Thank you very much, Dr. Michelle.